Joining me now via Skype from Kano is a public health physician, Dr. Usman Bashir. Dr. Bashir, good morning. It's good to have you join us right now on TVC Breakfast. Now, talk to us basically. A lot of people are concerned why it is taking so long, or it took so long to unravel the mysterious deaths that took place in Kano.
Good morning, everyone, and thank you for having me in your program. You can see what we're seeing is the unraveling of the mysterious death in Kano. This can be due to so many factors because, current in our community or society, we don't routinely conduct autopsies after death. So usually, and then even in our religious rites, when somebody dies, is hurriedly taken buried. And also, most of the people that died at home, either because they cannot go to hospital or they don't feel like going to hospital. Some even feel if somebody is old, he's just waiting for his time. So really, it's not easy for one to just pinpoint the cause of death until we have done a thorough investigation, like maybe a verbal autopsy or other form of studies that can be done to see and then also you need to look at the time of the year and last year and see whether there's an increase from number of deaths last year and then this year. So it's an other task, and then with the pandemic at hand, all hands are on deck to fight the pandemic. So it was later on that, and usually with most pandemic, that is what happens. Usually the vulnerable die, and especially in an environment where testing was not started on time. So we cannot pinpoint and say clearly this disease was caused by. So that's why there was a delay information that these deaths are related to COVID-19 or not.
All right, Dr. Bashir, what is the greatest challenge now in trying to handle and contain the situation in Kano?
Sorry, I didn't get you.
Doctors or medical personnel, and even for the government of Kano State, what is the greatest challenge now in containing the case in Kano?
I think the major challenge is we need to engage the major stakeholders in the community, that is traditional rulers, the religious leaders, that can talk to the people and let them understand this pandemic is real and we're already at the community transmission stage and we need to, all hands should be indexed. So it's a form of personal commitment. All of us need to make personal commitment, personal sacrifice, and it's already real. People are seeing it, people are dying. And then the government needs to protect the healthcare workers. The government needs to up its scheme, both the state and federal, to provide doctors, frontline staffs with the necessary personal protective equipment so that we can comfortably see the patient. And also, there's need for mass production so that people, everyone can wear masks. That's we're already doing those advocacy so that if people wear masks, healthcare workers will be comfortable to see them. And also, if the healthcare workers are provided with adequate uh, personal protective equipment, they can comfortably see the patients. And also, that will even reduce the mortality because most of those deaths are either due to chronic conditions or because of fear, people cannot come to hospital. And also, when they come to the hospital, also because the patient don't usually disclose if they have any symptoms that is COVID related because they don't want to be stigmatized. And then in the long run, even as you said, some of our doctors are infected within those processes because they inadvertently see a patient who may have not disclosed pertinent history that will rule out, that will show that it is either it suspected COVID, and then until maybe after the patient has died or before he dies, the symptom manifests and the sample was taken, and then result shows he's COVID positive, and then all the physicians that have taken care of those patients will be isolated, and that would reduce the number of providing services in Kano. So I feel, and we are the soldiers of the war. So people need to come clean and show real history.
All
And
right.
also the government provide, and not only government,
Yeah,
philanthropy.
Dr. Bashir, I'm losing part of your audio, so I think we have to leave it here now so we can put that straight before we have you back on. Thank you very much, Dr. Usman Bashir, a medical doctor reaching us from Kano in North. Joining me now via Skype from Kano is a public health physician, Dr. Usman Bashir. Dr. Bashir, it's good to have you join us right now. Now, make us understand basically how adequate testing kits and all of those equipment are in Kano, or how short in supply they are, to give us a picture to appreciate the situation in Kano.
Thank you for having me. As you can see, really with our population of about 20 million people and the testing capacity of about currently at about 40, 180, sorry, about 200 and something per day. It's really very short of the required number. And we can see nationally, there are about 2,500 tests being done daily, about 1,000 in Lagos, and the remaining part of the country, about 1,500. And I think that is looking at the population of Kano and Lagos. So I think Kano too should be given that number, which is also small compared to what is needed. So we need to do more, like the World Health Organization Director General said, we need to do more testing, and more testing. So there's need for not for only for testing in fixed locations. We need to do like what Ogun State is doing, that's mobile testing, whereby we can go into the communities where there are reported cases, so that we can do proper contact tracing, and then testing the community, creating awareness. But our major, I think, challenge now is creation of awareness, and then using the key stakeholders like the religious and traditional institutions, whereby people will be sensitized on what needs to be done, what needs to what they are supposed to do, how they are supposed to do it, and then also revamping the testing capacity of the institution where the testings are being done. And not only that, even the supply chain, we need to make sure that the testing kits are readily available, and even if they can be produced in the country, so that we don't need to wait for the logistics of supplying them from other countries. Because
Dr.
I think that's
Bashir, yeah, Dr. Bashir, you'll agree with me that at a critical time like this, enlightenment is key, especially when we hear that a lot of people still believe or don't believe that COVID-19 exists. Now, when it comes to urgent steps, what is the government already at this time doing to ensure that people get enlightened? Because that is where you even start from before the issues of management and containment or cure comes in, even though we don't have a cure for that yet.
yes. I think the major challenge is engaging the key stakeholders. That is, like I said, the traditional institution. I think if the government can sit down with the major traditional institutions, make them understand that this is what we have, and then use radio, because as you know, in radio and television, but majorly most people listen to radio. So I think if we can revamp up our campaign strategies in the radios, and then educating the public, even in our grounds, whereby we can at our homes, so that people will understand that we're at war, and in war we have to protect ourselves, and the only way we can protect ourselves is if we stay at home, and we minimize contact with other people, that's by social distancing, and we wash our hands regularly. And then people need to understand this is temporary. It's not going to be forever. And then we need to come, and the government cannot do it alone. Our philanthropists, our community members, our ward areas, we can come together and assist each other, so that we can pass through this struggle, because this struggle is not for me and for you, it's for all of us. So we need to understand that those of us that are downtrodden, those that cannot afford, and most of the people live on sustenance. They live on a day paycheck. So if they don't come out, there's no food on the table. So we need to come together. Those of us that have it should assist those that don't have it. And then we should also cooperate with the government policies, because sometimes people flood the rules. They don't have anywhere to go, but they just go out.
All
So
right.
we need to restrict our movement. Even on the days that the curfew are relaxed, people should understand that it's only when they really have to go out, they'll go out. If they don't need to have to go out, let them stay at home.
All right. We have to leave you here now. Dr. Usman Bashir, thank you so much for talking to us from Kano.